My name is Vinwell Daniel, and I'm currently enrolled into the surgical technology program at Herzing University. And today I'm going to be opening up my kit and my flashcards for the first time, just to get a feel and see how everything is. And I'm dressed the part, got my cap, my surgical cap and everything. So let's get started. So as you can see, these are all the tools, and I'm gonna empty all these. There's a lot of stuff in here. It's definitely a lot of stuff. Right here, these are the nail scissors. I'm trying to open it. Oh my goodness. Yeah. So these got a little bit of weight to them. They kind of look like regular scissors. Let me see that bend right there? So my first impression that these definitely sturdy and they heavy compared to some other scissors. I think they used to cut tissues like muscle during surgery. It will probably be used in general surgery or anywhere where it needs to get through thicker skin. I noticed they got this curve at the top too, but it looked like it doesn't. These are very interesting. I feel like these would be one of the most used ones in surgery. Right here, the yank core suction tool. I noticed these. These, I'm always seeing these. It's designed for sucking fluids like blood or irrigation during surgery. I know it's used a lot in general surgery, but also in ENT or even in tonsillectomies. I gotta fix my vocabulary. I feel like I felt like I said it wrong. It seems like a very practical instrument to keep the surgical field clear. I'll fix that later. The Diva retractor, size 2. Whoa. So all these loops in it. So here is the Diva retractor. Diva, excuse my language, the Diva. My first impression is that it's pretty large and curved. So I think it's used for holding back deeper tissues or organs to give the surgeon a better view of the surgical site. I imagine it looks like a tool that would need 2 hands to position properly and keep in place. Hopefully I'm right about this. It does look like you're supposed to separate and take, you know what I'm saying? That's what it looks like with this. The Diva retractor, size 2. The last one, the Atom Tissue Forceps, 4.75 teeth. Give me a second. I'm trying to get it out the best way I can. Just have to take this off. Okay. This kind of looks like. See these teeth? It's so small. I feel like these were hard. These would get mistaken for another one of these that I have in here. Let me see. It kind of looks like the tissue forceps. It kind of looks like this one, but this one. See the difference in size. I'm just showing just as an example. And put this one back. These are the Addison tissue forceps 4.75 with teeth, and that was what I noticed on this little small tooth. I think these are used to grab onto skin or delicate tissue without slipping. That's why the teeth is so small. Without slipping, probably during wound closure or when the surgeon is suturing. I could see them being used in plastic surgery or really any procedure involving skin. Flashcards. Let's see what we got. Yeah. Okay, we got these cards right here. What is the name of this instrument? I'm gonna try not to look. I seen this. Hold on. Honestly, I'm glad these flashcards came in because this is really gonna help me. I can really, on my downtime, instead of hopping on the video game, I could just practice these cards. But this has to be the Lothrop uvula retractor. See, I figured it's a retractor. It got to be a retractor because it's always the. I got it right. I wasn't even trying to look at the answer. But when I see these, I automatically think of retractor. When I see this on the tool, I don't know. I could be wrong about thinking every tool has that. Oh, this is an easy one. What are these? These are surgical towels. That was easy. That's an easy one. What are the name of these instruments? This is... What is this? Hold on, I'm about to cover the answer. It's a word I couldn't really pronounce. I gotta learn it. That's one of the things that I want to start getting my pronunciations right. It is a disposable laparoscopic trocars. I think I got it. I'm not gonna count this because I didn't say I didn't put the millimeters on it, so I'm gonna say I got that one wrong. I'm not gonna give myself full credit for that one. I know this one. This is a laparoscope. What is the name of this instrument? It's a laparoscope. That's what this is. I figured that's what it was. Honestly, I think this is going to come in handy for this semester now, because this was honestly, I feel like this was what I actually needed, because I figured this was going to be my biggest challenge, just learning these tools. And now that I have a little kit, I have a kit that's going to help me get through all this, and I feel really confident now. If I just apply what I need to apply into all of this, I can definitely pass this semester with these tools. But this is good. I'm glad this came in. Thank you guys for watching my video, and maybe I'll post a video letting y'all know how I do on my test when it comes down to this, how I do by the end of this semester. Thank you. Thanks for watching.